Good morning. My name is Rochelle Kelly DeVargas. I'm the Director of Marketing here at St. Mary-Corwin, and I would like to welcome you to St. Mary-Corwin for today's exciting announcement. What we will be doing here, we have some speakers to announce this great new partnership between St. Mary-Corwin and Pueblo Community College. And after that, we will have a chance for questions. And if the media would like individual interviews with anyone after that, we'll be happy to entertain that at that time. So, with that in mind, I would like to bring up Patty or Javic, President of Pueblo Community College.
Good morning. I have to tell you, I am absolutely thrilled to be here today and to participate in what we know is going to be a wonderful partnership between Pueblo Community College and St. Mary-Corwin Hospital, the Centura Health Network. Today we are going to embark upon one of the first of what I hope to be many community living labs in the communities that we serve, and how appropriate that we start with our healthcare programs that play such a vital role in our community. We are going to be able to join forces. We have invested our Perkins dollars, well over $300,000 at this point in time, to create this living lab on the sixth floor here at St. Mary-Corwin, where our students are going to be able to take their academic experiences and really enjoy the relevance of what it is that you're going to be learning in the classroom as you work side by side with the doctors and the nurses and the other healthcare professionals here at St. Mary-Corwin, still in that learning environment before you do go off into the clinical environment. We're thrilled to be able to partner with St. Mary-Corwin, and really this is another step in the PCC promise to make sure that our students leave us as graduates that are well prepared and very capable. I guess my whole goal is that when St. Mary-Corwin sees a nurse or a respiratory care or an EMS or whatever, that they say, PCC graduate, come on in. We know that you're well prepared, well qualified, and we want you on our team. So with that, I'd like to introduce Rob Ryder, who is the other partner in crime as far as this goes. And again, Rob, thank you very much for entering into this on behalf of the students and the community.
Well, thank you, President Javic. That really summarizes well, I think, what we're doing. You know, we're so fortunate in Pueblo for a community our size to have two institutions of higher learning that we can partner with as healthcare providers. And there is so much, I think, I can't speak for my colleague Mike at Parkview, but I can tell you that both hospitals truly benefit from what higher learning brings to this community in terms of advancing healthcare, in terms of providing a skilled quality labor force that we can use and hire to then provide healthcare not only to Pueblo but to all of southern Colorado. So partnering with higher education is a huge part and a hugely important part of what we need to do. The partnership with PCC, I think, is prototypical in terms of how partnerships should work, because we're taking what we do well as a hospital and our assets and combining that with what PCC does well as a learning institution, expertise, equipment, and we're putting those two things together. And what is it they say about the sum of the parts is great, or the whole is greater than the sum of the parts? You know what I mean. This is truly an example of that, where us working together is going to create something that neither one of us could do by ourselves. So I think having a sim lab in a live hospital situation, and I love the idea of living lab. That's what it is. So you get to come into the hospital, you're going to walk through the halls of the hospital, you're going to feel the environment, the intensity of what it's like being in a hospital. And even though the patients in the sim lab aren't quite as lively as some of our normal patients, you're going to be feeling like this is the real deal. And sim labs are the real deal in terms of providing the opportunity to practice skills in a way that's meaningful in a way that allows you to build skills that are going to move you into the future in terms of your careers as students and for, frankly, for our existing staff in terms of enabling them to, on a continuing basis, upgrade and check their competencies. Can't tell you how important that is. And to have this resource here on site, occupying space here, you're actually going to get to learn how to, in conjunction with the sim lab, the medical record, the electronic medical record. I mean, all those things as healthcare evolves, we get to do all that, and it's like for real, but we don't have to worry about are we going to hurt anybody. And, you know, in healthcare, that's the bottom line, is how do we keep folks safe? And at the same time, develop quality professionals who are going to move the healthcare industry and profession ahead. So this is, it's a privilege to be partnering with PCC. The whole staff is just terrific, and putting this together has been, a lot of deals are hard to put together. This wasn't a hard deal to put together because I think we're so aligned in terms of our values, in terms of what we want to do for the community. I'd like to mention just a couple people on our side. Dave Noble. Dave, if you'd raise your hand. Dave's been on the point and working with us to make all this work and has done a fabulous job in terms of coordinating for the hospital. Lori Briggs, I don't know whether Lori's here, but this is a big IT thing. In healthcare anymore, IT is, we spend more on IT than almost anything else, it seems like. But the IT piece of this has been huge, and Lori Briggs has done a great job with that, and Dave Colorelli from our facilities department, who's played a huge role in preparing the space, getting the rooms ready. And I can't tell you, when we built our West Tower a few years ago, it's been 6 years ago, 7 years ago, one of the challenges that we had in terms of moving most of our acute care into the new facility was how do we make good use of the asset that remains, the East Tower? And this building that we're in has served a whole lot of people. I've told the story often that I was actually born in this building, as was at least half of Pueblo, if not more. And it's served us well. And our challenge has been how do we continue to use this asset once we built the new tower to continue to serve the community. The Sim Lab, the project with PCC, is exactly the kind of things we're looking for. It's using our assets to move healthcare ahead, to advance quality of life in Pueblo, and to allow us to partner with higher education in a way that I think is going to be good for students, good for our staff, and good for the community. So to PCC, Patty, the whole staff, thank you so much for everything that you're bringing to this project, and we're excited about it. Thank you very much.
Thank you, Rob and Patty. Now we'd like to have two other speakers come up who really know from a nursing perspective what this means as nurses themselves, as educators. So first I'd like to bring up Donna Fisher, who is the Chief Nursing Officer here at St. Mary-Corwin, and then we'll have Eve Tapia, who is the Nursing Program Director for the Department of Nursing at PCC.
Thank you all for being here today. We're so excited about getting the Sim Lab, and I think one of the things that Rob touched on a lot of the points that I was going to touch on, so he stole my thunder. But anyway, one of the things that we would like to obviously do, partnering with PCC, is I think the collaboration that we are going to have with them is phenomenal. Having the Sim Lab on site allows the students to get that experience, that day-to-day experience of what's going to be like to be in a hospital and actually take care of a patient. And then also it's going to be important for our own staff that we already have. All of our nurses that we have, we go through annual competencies every year. This is an opportunity, working with PCC, that we'll be able to utilize the Sim Lab as well for our own nursing staff that are already, that have been here for some of them years. I mean, we've got nurses that have been here for 20 and 30 years. So this will be an opportunity for them to actually get in and see how new technology works, get to do their competencies, to stay up to date with all of the different things that healthcare, the technology changes every day. So it's an opportunity for us as well as for the students, and we're so thankful to be able to collaborate with PCC on this and look forward to utilizing that space to its fullest potential. I think it will probably be running 7 days a week, especially first, as we get going into this, so that we can utilize the space for our own staff as well as for the students. So thank you all. We're very excited about this and look forward to moving on.
Thank you, everybody, for coming. I'm just truly excited about this endeavor. It really started with a phone call that I had with Teresa one day asking if there was any space at St. Mary-Corwin to put our simulation equipment. And it has become this vision, this education vision for us. So I thank President Javic for having that vision with us and supporting us, supporting the budget that it takes to do something like this. I think at times education and practice run in two very separate pathways, but we have very similar goals. So I thank Mr. Ryder for letting us merge those two pathways into something that is going to really improve education for our students, but I hope improve clinical practice overall, because our main goal is truly patient care outcomes and improving those patient care outcomes. I'm excited about being here. I'm excited about this project. I know a lot about birthing babies, but I don't know a lot about technology. So I thank Lori and Dave here at St. Mary-Corwin. I thank Brian at PCC for telling us all of these things that we really didn't think about when I really just wanted a room. It became much bigger than that. So I thank everybody, and I'm so excited. I'm so excited that our faculty will be able to teach here. I'm so excited that our students will be able to learn here. And I'm excited that the population in Pueblo is going to benefit from a graduate and from staff who learn in a high technology setting that will really improve their outcomes and will improve healthcare here in Pueblo. So thank you everybody so much for participating in this, and we're just excited. Thank you.